was a wake-up call for countries to prioritize emergency care. And we're glad that Nigeria has keyed into that. What's going to happen this afternoon is the first step in that direction. The signing of the MOU, the dotted lines that will commit the relevant organizations that will drive that. Of course, with the Federal Ministry of Health on the driver's seat. So I welcome you all, and I hope that this will translate to what we all look forward to, emergency care, at its best in Nigeria. Thank you. So let me quickly run through the list of dignitaries present here today. We'd like to welcome the Honorable Minister of Health, Professor Osage Ehanire. Also in our midst today is the Honorable Minister of the Federal Capital Territory, Alhaji Musa Bello. A round of applause for him, please. We equally all were expecting the Chairman Senate Committee on Health, Dr. Ibrahim Oloriegbe. Oh, sorry, I missed out. We also have in our midst the Honorable Minister of State for Health, Dr. Olorunimbe Mamara. And of course, while I was on the introduction, we just witnessed the arrival of the Honorable Minister of Humanitarian Affairs, the Amiable Hajia Saidia Farouk Umar. We have a formidable team from the Federal Road Safety Corps, represented by Ojeme Rujapo, the Deputy Corps Marshal, Administration and Human Resources. I will at this juncture hand over to my co-anchor, Olawale Opele, to continue with the introduction of dignitaries. Thank you.
Thank you very much. On behalf of the Honorable Minister, Dr. Osage Ehanire, as well the Minister of State, Federal Republic of Nigeria, Federal Ministry of Health, Dr. Senator Olorunimbe Mamara, you are all welcome. All the dignitaries here present. Likewise, the FCT Minister, Alhaji Muhammad Musa Bello, you're also welcome. I have here with me Dr. Alex Oko, who is ably represented here by Permanent Secretary, Federal Ministry of Health, Madam Mahmouda Mama. You are welcome. You are all welcome. Huh? Also, I have here with me the Permanent Secretary, Federal Capital Territory Administration, Mr. Olusade Adeshola. You are welcome, sir. Please, a round of applause. Also, I have here with me the Director, National Health Insurance Scheme, Professor Sambo. You are welcome, sir.
From the Executive Secretary, National Health Insurance Scheme, Professor Sambo, we move on to the recognition of other dignitaries present. The NCC is here, represented by, on our list here, we're supposed to have the Minister of Communication and Digital Economy, but he's not here, but there's a representative from the NCC, and he's no other person than Dr. Dambatsa was supposed to be here from the NCC, but he's been represented by the Director, Public Affairs, NCC, Dr. Ikechukwu Adende. A round of applause for him, please. We also have in our midst the Chairman, Health Commissioners Forum. She's a chairperson. Dr. Betta Edu is in our midst. The beautiful Betta Edu is here. Good to see you. We'll move on with more recognition as the events unfold, but we'd really like to recognize the presence of members of our development partners who have been with us and are always supporting and are formidable partners even in this initiative. We have the World Bank, we have the WHO, UNICEF, they are all here on ground, and we'll continue with the recognition as time goes on. But without wasting much of your time, because our time is fast spent, I would like to quickly welcome Dr. Seyidu Ahmed Dumbulwa. He is the National Program Manager for Nemsas, to give us his welcome address. Dr. Seyidu, please.
Bismillahirrahmanirrahim. The Honorable Minister of Health, the Honorable Minister of State for Health, the Honorable Minister, Federal Capital Territory, FCTA, my eldest sister, the Honorable Minister of Humanitarian, permit me to stand on the existing protocol as I also welcome permanent secretaries and other important dignitaries here. It is with great pleasure that I welcome you to this important event of signing MOU on operationalization of National Emergency Medical Service and Ambulance System, Nemsas, which is a long overdue services to people of Nigeria. Nemsas is an innovative program aimed at addressing the missing link in the Nigerian health sector, which, if operationalized, it will change the narrative of current indices, especially of the maternal and child mortality. It is the implementation organ to operationalize the National Emergency Medical Treatment Committee, NEMTC, of the Basic Healthcare Provision Fund. The 64th National Council on Health approved the collaboration of the Nemsas with partner agencies and subnational governments as a private and public sector-driven initiative to utilize the existing private-public medical assets as the mechanism for achieving the effective national emergency medical service provision. Nemsas has developed an implementation manual and other strategic guidelines to define the collaboration with subnational governments and other partner agencies. Memorandum of Understanding will be signed today with the Federal Safety Corps, the National Health Insurance, the Association of the Private Medical Practitioners of Nigeria, the Guild of Medical Directors, and the host, the Federal Capital Territory Administration, for the operationalization of the immediate pilot phase rollout in the FCT. This is to symbolize our collective commitment of partnership as we work in the spirit of inclusiveness to achieve the aspiration of Nigerian populace and to deliver Mr. President's priority agenda and ministerial deliverables. Emergency medical system address a diverse set of diseases along life course that span the spectrum of communicable infections, non-communicable diseases, obstetric emergencies, geriatric emergencies, and injuries. Emergency care must be appreciated as an entire system with independent components. These components include pre-hospital care, transportation, and hospital care. Each component is important, but all of them must work together to make a lasting effect on the health of a population. This is the first time stakeholders come together to sign Memorandum of Partnership and launch first implementation manual for emergency medical service and ambulance system in our dear country. The goal of today's event is to set up a platform, make necessary tools available to operationalize the Nemsas program in a bid to save the lives of the poor and vulnerable Nigerians through provision of accessible, free medical emergency service, and ambulance system at no cost to patient at a point of care in the first 48 hours in Nigeria. Distinguished ladies and gentlemen, may I state that emergency medical systems are a critical component of national health system in our country. Therefore, we need to pay specific attention to implementation of Nemsas and ensure that evolution of emergency medical service is both evidence-based and appropriate to our national needs as Nemsas program. I call upon all stakeholders to actively partake in this collective push to ensure effective implementation with sustainability of the program, coordination, transparency, and accountability from both public and private health sector. Once more, I welcome you to this very important event and wish us fruitful and robust deliberation. Thank you. God bless you all. Thank you. Assalamu alaikum.
Thank you very much, Dr. Seydou Ahmed Dumboa, the National Program Manager, Nemsas. We appreciate you. In the course of a welcome address by Dr. Seydou, we welcome the Chairman Senate Committee on Health, Federal Republic of Nigeria, Dr. Oloriegbe. You're welcome, sir. Please, a round of applause. Also, we recognize Dr. Felix Ogedembe, Chairman, National Emergency Medical Treatment Committee. You are welcome, sir. Also, we have in our list here, Honorable Tanko Sununu, Chairman House Committee, House Representative Committee on Health. You are welcome, sir. Thank you very much. Also, we have Dr. Ebi Okairo, Director General Governors Forum. You are welcome, sir. Likewise, Dr. Betcha Edo, Chairperson, Commissioner of Health Forum and Commissioner of Health in Cross River State. You are also welcome. Thank you very much. On that note, let me invite Dr. Felix Ogedembe, Chairman, National Emergency Medical Treatment Committee, to come to the podium for opening remarks. Thank you. Please, a round of applause for him.
The Honorable Minister for Health, Honorable Minister for the FCT, Honorable Minister for Humanitarian Affairs, Honorable Minister of State for Health, Permanent Secretaries here present, Chairman of the Senate Committee on Health, Country Directors, WHO, World Bank, UNICEF, Executive Secretary, NHIS, Chairman of the Committee of Commissioners of Health for Nigeria, all of that protocols duly observed, distinguished ladies and gentlemen. It's my pleasure to welcome everyone to this auspicious occasion on the public signing of the Memorandum of Understanding for operationalizing the National Emergency Medical Service and Ambulance System, Nemsas for short, and also the occasion of launching of the Program Implementation Manual. The NEMTC, which is the National Emergency Medical Treatment Committee, was inaugurated in February 2019, 3 years ago, with the twin mandate of operationalizing the 5% Emergency Medical Treatment Fund of the Basic Healthcare Provision Fund and leading the creation of an emergency medical service for Nigeria. This latter mandate has led to what we're witnessing today as the signing of the MOU for Nemsas and the launch of the manual. Over the last 3 years, a lot of work has gone into making this framework come into being and also developing the manual. I do extend my sincere gratitude to all those who have contributed immensely in this work. The signing ceremony is quite timely considering the ongoing discussions on how to achieve universal health coverage for Nigerians. We all know how important universal health coverage is. The establishment of an EMS service, emergency medical service, has now has to take the front seat in the conversations as we begin to understand its deeper impact in healthcare for our people. The 2019 World Health Assembly did emphasize a lot on the need for an EMS system. In a recent World Bank report dated 15th of February 2021, sub-Saharan African health systems were noted to have historically focused in their bid to address healthcare problems on primary healthcare only because of the high rate of communicable diseases. This paper goes on to say, and I quote, with increasing rates of trauma, of road trauma, along with other life-threatening conditions, such as non-communicable diseases like cardiac arrest and stroke, that require urgent medical attention, many countries must now look to develop emergency medical services. They should also be made a priority because of the increasing incidence, increasing morbidity and mortality from medical, surgical, obstetric, and pediatric emergencies. And this has now become so important that it has reached the crisis level, and sub-Saharan African countries would now have to prioritize the setting up of EMS. Locally, we have also seen an increase in interest in EMS services, with several multi-city services now registered and starting to run in Nigeria. It is therefore hoped that the timely implementation of Nemsas will follow this signing ceremony and will provide the much-needed coordination and leadership in the EMS sector. The choice of the Federal Capital Territory as a pilot state is very well suited, considering the support that we also received from the Minister of the FCT. And it is also strategic to note that the emphasis has been on the utilization of existing public and private EMS providers, such as to ensure sustainability. I do welcome everyone to this epoch-making occasion, and I wish all of us a successful signing and launch ceremony. Thank you.
Thank you. That was Dr. Felix Ogedegbe, Chairman, National Emergency Medical Treatment Committee. Next on our agenda is the goodwill messages, and we have the dignitaries lined up for that. We're going to start with the Chairman, Senate Committee on Health, Dr. Ibrahim Oloriegbe. Distinguished Senator Oloriegbe, please. Just before the distinguished takes his position on the podium, we would like to remind everyone coming up here that only 2 minutes have been allocated to your presentations. Please, let's keep to time so that we can all move away from here to attend to other things. Thank you. Distinguished Senator, please.
Thank you very much. Well, I am speaking on behalf of National Assembly, so I will have double of your 2 minutes. Because I have the mandate of my colleagues from the House of Rep to speak on his behalf. He's not in town today. Also, in National Assembly, our job is to speak. So I will speak as much as I can, but I'm mindful of the time. Honorable ministers here, directors from the Federal Ministry of Health, development partners, distinguished ladies and gentlemen. I'm delighted to be invited to this very epoch-making occasion, a very important step in terms of expanding, improving, and deepening our health sector. We have primary, secondary, and tertiary healthcare, but there is also another wing, or another sector. It's not the ordinary care, but the emergency care is a very critical part. As National Assembly, we have been part of this process for a long time. Our National Assembly passed the National Health Act that provided a fund in 2014. Of course, that fund, as at that time, was specifically looking at the sovereignty of Nigeria from emergencies, particularly road traffic accident, gunshot wounds, and so on, who are not attended to because there's no money, because it can happen to anybody. You are just traveling, you had an accident, even if you're a multi-billionaire, as at that time, your billions are not affected, not available to you, and you must be treated. So the original bill did not make that provision. It only made provision of 50-50% to NHIS and MPCDA. The legislator at that time thought it fit that 5% should be for emergency. However, something happened before the bill was implemented in 2018, or was before that 1% was implemented, which was Ebola. Then the National Center for Disease Control was created, which was the newest agency as at that time. And as such, it was interpreted that emergencies cover not the injury or what I would call the injury kind of emergency, but include even the infectious and so on emergency. And in the drafting of the guideline to implement the National Health Act then, the then ministries and the stakeholders interpreted it to be that the fund would be given both to NCDC and the emergency. Now, two things happen again. The National NCDC Act was passed in 2018, and it referred to that fund to say it will get 5% of the 5%, which was, or 2.5 of the 5%, which was a mistake in drafting, but was interpreted appropriately, whereas the other will go to the emergency. But just like any human drafting, the National Health Act did not make specific provision of the mechanism through which that fund will be used. It only said there will be a committee. And as we know in civil service, committees is ad hoc. So I'm starting from that to show that the Parliament, as part of its primary responsibility, has seen all this. And we have come up with the National Emergency Medical Services Agency Bill, which was passed in 2021 by the Senate. It's been transmitted to the House for concurrence, and my colleagues in the House are supporting it. It's already taken through first and second reading in the House of Rep. That will come on board to be able to actualize and give effect to what we are doing today. Because like in any country, emergency services is a very critical component of healthcare. It happens at any time, it happens at all times, and we must have a system which is robust enough to be able to respond to it. So therefore, we support what is happening today, but we are supporting it more to back it up with appropriate legal framework that will make it to be able to operate within the system. And it's a multi-sectoral. The law provides for multi-sectoral participation as it's required. In fact, in terms of the board of the agency, in terms of the staffing, and in terms of funding, because the current money from the Basic Healthcare Provision Fund is not adequate and it's not enough to be able to take care. I want to say we have moved ahead also, even in addition to that share, as proposed by the executive, we noted it and we approved about 1.2 billion naira in the current 2022 budget for the emergency care services. And I hope that will be released fully and will be implemented. So on this note, I congratulate all the stakeholders for this step of today, and I assure you that National Assembly will be there to ensure that we provide the necessary legislative backing for its implementation, and we provide necessary legislative intervention in terms of oversight for whatever resources and policies that are developed so that Nigerians can benefit a very effective emergency service. Thank you. God bless.
Thank you so much, distinguished Senator Ibrahim Olori-Egbe. You know what happens when an initiative has the full backing of the National Assembly. It happened with the National Health Act, and of course, we're still, having a good feel of fallout of the National Health Act, which is still what is happening today. The fact that from the National Basic Health Fund, Provision Fund, there was an allocation has been made for the emergency medical ambulance system, which is what is happening today. Thank you so much. We look forward to that leadership that will ensure a successful implementation of this human-saving, life-saving initiative. Thank you so much. So we move on now to the next goodwill message. And we have the Honorable Minister of the FCT. As you were told much earlier on, the FCT is where the pilot of this initiative, it's taking place. And we have the Honorable Minister, Alhaji Muhammad Musa Bello, to come up here now to give us his goodwill messages. A round of applause for him, please. The success from the FCT will determine how far we'll go. Thank you, Honorable Minister.
Thank you very much. The Honorable Minister of Health, the Honorable Minister of Humanitarian Affairs, the Honorable Minister of State for Health, our very distinguished Chairman of the Senate Committee on Health, other distinguished ladies and gentlemen, on behalf of the FCT administration and residents of Abuja, the federal capital city, it's my honor to welcome you to this very important occasion, and also to thank the Honorable Minister of Health for making Abuja the pilot city for the operationalization of the National Emergency Medical Services and Ambulance System, Nemsas. We feel highly honored. The signing ceremony is coming after a series of meetings from many agencies, including the FCT Health Secretariat, to ensure the takeoff of this scheme, with us serving as the pilot. On behalf of the city and the entire administrative structure of the Federal Capital Territory, I assure you of our total commitment to this very laudable step, and I assure you we'll host the pilot scheme and work very closely with you so that it can be expanded to all parts of the country. Thank you very much.
Thank you so much, Honorable Minister. Next on our lineup, it's the goodwill message from the Honorable Minister, Humanitarian Affairs and Disaster Management and Social Development, Hajia Saidia Omar Farouk.
The Honorable Minister of Health, Dr. Osagi Ehanire, the Honorable Minister of the Federal Capital Territory, Alam Muhammad Musa Bello, the Honorable Minister of State Health, distinguished Senator Mamora, Chairman Senate Committee on Health, the Chairman Senate House Committee on Health, heads of agencies here present, permanent secretaries, distinguished ladies and gentlemen of the press. Let me use this opportunity to congratulate the Honorable Ministers of Health on the launch of the Emergency Medical Service and Ambulance System, Nemsas, and its manuals, which have now defined and established a much-needed framework and structure towards decentralizing and providing access to emergency medical service to all Nigerians. Nemsas is an essential ecosystem towards disaster risk reduction and governance for the health sector. Not long after the establishment of my ministry in 2019, the nation was confronted with the COVID-19 pandemic. And in response to the pandemic, we actively collaborated with the Federal Ministry of Health and its agencies as lead and played a critical role through the National Emergency Management Agency, NEMA. NEMA led the security, logistics, and mass care pillar of the Presidential Task Force and directly provided socio-economic interventions to Nigerians to withstand shocks and build resilience, especially of the affected vulnerable communities through our interventions, as well as through our social investment programs schemes. This experience has highlighted the importance of coordination and collaboration between ministries, departments, and agencies at the federal, state, and local government levels. I'm happy today that this message of coordination and collaboration is reiterated in the Nemsas manual, and stakeholders have clear roles and responsibilities towards enriching our emergency medical services. It is important to note here that in 2014, the National Emergency Management Agency, an agency under the purview of my ministry, collaborated and launched its emergency response ambulance base project that was piloted in Abuja to provide life-saving first aid while transporting casualties to health and treatment facilities. The plan was to replicate the model across all states of the Federation. There were 5 bases spread across Abuja metropolis, with each ERAB equipped with mobile intensive care unit ambulances, an incident response vehicle, and trained human personnel from the NSCDC and FRSC, the military, and health stakeholders assigned to each of these bases. Over the years, NEMA ERAB bases have unfortunately been vandalized and will require your support, the Ministry of Health, for revival. Nevertheless, NEMA currently manages 3 of such ambulance operation bases, comprising of the Mobile Intensive Care Unit ambulance in its Abuja Operations Office, and a recently revived air ambulance for search and rescue operations. We therefore look forward for collaborations with the Ministry of Health towards assisting the most vulnerable. And at this point, I would like to request, honorable ministers, that NEMA is included in the implementation unit as an observer and stakeholder for better information sharing and knowledge transfer. I assure you that NEMA will work diligently to adhere to the standards set out in Nemsas as it carries out its own operations. The Federal Ministry of Humanitarian Affairs, Disaster Management, and Social Development also recently published Nigeria's risk analysis dashboard, which presents the most common and recurrent hazards and their severity by local government, broadly including floods, endemics, and conflict. More specifically, most metropolises face incidents such as fire hazards, road accidents, and building collapses that have required the use of ambulances. And I'm sure this initiative today will go a long way in supporting most of the work that we do in NEMA. Thank you very much for your attention.
Thank you, Honorable Minister. So much pledges of concerted efforts and support for the success of the National Emergency Medical Service and Ambulance System, Nemsas. Before I take the next goodwill message, I would like to quickly recognize some dignitaries here. Professor Awal Abubakar is chairman of Committee of CMDs. You're welcome, sir. We also have in our midst Dr. Jaff Momo. He is the Chief Medical Director of the National Hospital Abuja. Welcome, doctor. We also have the Executive Secretary of the Country Coordinating CCM, Country Coordinating Mechanism for the Global Fund, Mr. Dozier, is in our midst. We also have at this auspicious event, the representative of the National Hajj Commission, Al-Haji, the name is not, Al-Haji is Priscilla Ensemble, but it's not properly written here. Okay, we have a representative of the National Hajj Commission here in the person of Al-Haji Mohammed Suleiman. It's good to have you in our midst, sir. We also have here the Chief of Staff to the Honorable Minister of the Federal Capital Territory. You're all welcome. So moving on, we take the next goodwill message. Like I mentioned earlier, the Federal Road Safety Corps has a formidable team on ground for obvious reason. And the Corps Marshal is not here, but he's represented by Ojeme Erujapo, Deputy Corps Marshal Admin and Human Resource. A round of applause for her, please.
The Honorable Minister of Health, Dr. Sage Hadire, the Honorable Minister of the Federal Capital Territory, Alhaji Mohammed Musa Bello, Honorable Minister of Humanitarian Affairs, Disaster Management, and Social Development, Hajia Sadia Umar Farouk, Honorable Minister of State Health, Distinguished Senator Dr. Adeleke Bamura, Distinguished Senator Dr. Ibrahim Oloriegbe, Chairman, Senate Committee on Health, I wish to respectfully rest on established protocols. My name is Ojema Erujapo. I'm representing the Corps Marshal, who unavoidably is absent. So what I'm reading is his speech. I want to sincerely congratulate the Honorable Minister of Health, Dr. Hanere Osage, for finally launching the National Emergency Medical Service and Ambulance Systems, Nemsas, after over 3 years of working silently and diligently on modalities and its implementation. The Federal Road Safety Corps has a symbiotic relationship with the Federal Ministry of Health in providing emergency health care service and primary health care to Nigerians, which we provide through our roadside clinics to communities where we are located. The FRSC has an emergency ambulance service codenamed Zebra. We started as a pilot scheme in FCT in the year 2009 and has been replicated all over the nation with over 54 Zebra state-of-the-art ambulances and facilities with well-trained medical personnel. Apart from the Zebra ambulance system, FRSC has about 54 other ambulances placed in operational offices, bringing the total number of ambulances to 108 all over the country, with plans to increase the number and spread in 2022. The ambulance system is backed by a 24/7 emergency call center with a toll-free number 122 on all GSM networks. The call center receives calls from Nigerians for medical emergencies, disasters, security threats, even women in labor, and the call responds appropriately to such calls. By signing the MOU today, FRS is ready to deploy all her ambulances in FCT to kickstart the pilot project. However, the Corps wishes to solicit that all officials of Nemsas fulfill their promises by paying regularly and promptly for the services that these ambulances will render to Nigerians to enable the scheme work effectively. I want to commend the Honorable Minister of Health for this great stride and achievement, and enjoin all stakeholders to strive to ensure the success of the scheme. The FRS is ready to be part of this humble project and would commit its experience, resources to ensure its success. I want to sincerely thank everybody who is here for being part of this great project and who help to improve emergency response in Nigeria. Thank you for coming, and God bless the Federal Republic of Nigeria.
Thank you so much. The next goodwill message is coming from the Nigerian Governors Forum. As you're aware, an important and a life-saving initiative such as this must have adequate buy-in of states. And it's on that note that I would like to invite the Director General of the Nigerian Governors Forum, Dr. Abi Okauru, for the next good message. The next goodwill message. A round of applause for him, please.
Good afternoon, ladies and gentlemen, and honorable ministers, distinguished ladies and gentlemen, and our development partners. From the Governors Forum, we have just 3 messages. The first will be that the governors are completely on board. I mean, I remember during the planning stages, the minister and the team actually made a presentation to the governors, and that was well received. So governors are completely on board, I mean, with this. Secondly, I want to state too that a number of states have this kind of system already in place, and I think there's some learning to do. The impact of this, of course, will depend on how much difference you're able to make at the subnational level. And I'll just say it here that the governors will be ready. The last point I think we want to make is that it's important we make this equitable, affordable, and accessible, especially to the poor and vulnerable. Just to underscore the point made by the Minister for Humanitarian Affairs a couple of minutes ago, it's important that this is accessible to everybody. At the Secretariat level, we'll be ready to push this forward. Thank you, ladies and gentlemen.
Thank you so much. Certain honor in one. It's good to know that we're all on the same frequency where this initiative is concerned. Moving on to the next goodwill message. It's coming from Dr. Betta Edu. Dr. Betta Edu is the chairperson, Commissioners of Health Forum, chairperson, Commissioners of Health Forum, of Nigeria. Thank you.
The Honorable Minister for Health, the Honorable Minister for State Health, Honorable Minister for FCT, Honorable Minister for Humanitarian Services, the Senate Committee Chairman on Health, all the very distinguished dignitaries that are present here, the ES and HIS, good evening. I speak on behalf of the Commissioners for Health in Nigeria. First, I must really strongly commend the President Muhammadu Buhari, for the implementation of the Basic Healthcare Provision Fund, which is making a lot of difference in our health sector, pushing the agenda forward. I want to also very strongly commend the Honorable Minister for Health and the Honorable Minister for State Health for the wonderful work they have done implementing the Basic Healthcare Provision Fund. This National Emergency Medical Service and Ambulance System is actually a baby at the heart of the Honorable Minister for Health. I cannot remember one discussion I've had with him that we have not ended with this topic, providing emergency care for Nigerians. And I'm really very happy today that this is finally becoming a reality. How to start, my father used to say, is to start. I'm happy we're starting today. I'm really so proud of the work that has been put in so far. I would want to state that Commissioners for Health, who are really your foot soldiers and the drivers at the state level, the subnational, would be able to drive this to ensure that it is properly implemented in Nigeria. In our various states, like one of the speakers had said, states have made different successes or advancements in providing emergency care. And we can capitalize on this to make it more sustainable and more effective. In my state, for instance, we had over 80 the Keke ambulance, which was distributed to rural areas. We can link all of this to the general system and make them more efficient. I'm sure Lagos State and several other states have some very efficient form of ambulance services ongoing. But what is most important is the fact that we can learn from each other, we can give feedbacks forward and backwards, from the bottom up, and then of course from up down, so that we can improve on what we have on ground. It would be important to immediately call the commissioners for health together, discuss this manual fully, and then really empower them to go ahead and begin all the trainings that are required and all the local supports they need at their level. Remember, we have both the urban centers or the urban states, and we have rural states. And so implementation would differ at these levels. And I'm very confident that with the step we've taken today, we'll be able to push implementation down to the grassroots. Our women are dying. Our children are dying. Sometimes it's so difficult to take them from hard-to-reach areas to where they can access care. Sometimes people arrive at health facilities and are unable to get care because they do not have monies in their pockets to pay for this. I think this is the solution, and we'll work together with you, Honorable Minister, to ensure that this becomes a reality and Nigerians would benefit from this en masse. Once again, thank you for having us here, and we commit to the success of this program. Thank you.
Thank you, Dr. Betta Edu. I shared in your passion as a woman, and we know what happens when a woman holds sway. I believe she's going to galvanize her co-commissioners to really deliver on this. So moving on, we'll take the goodwill messages now from the development partners. And to lead the pack is the country representative of the World Health Organization in Nigeria. He's no other than Dr. Peter Kazode. Dr. Walter Kazode makes his way. A round of applause for him, please.
Thank you, Moderator. Your Excellency, the Minister for Health, Excellencies, Minister for FCT, Minister for Humanitarian Affairs, Minister of State for Health, Member of the Senate, the House of Representatives, partners, other dignitaries here present. I am truly happy to be part of this history-making event. The signing of the MOU and ministerial launch of the implementation manual for the National Emergency Medical Services and Ambulance Systems, Nemsas. This is yet another milestone in the health reform efforts toward universal health coverage and health security in Nigeria. As Dr. Tedros said it over and over again, universal health coverage and health security are two sides of the same coin. Both are needed to achieve better outcome for the population. I heard the Chairman Summit Committee mentioning some interpretation issues of one of the articles of the basic healthcare provision that enable to use the fund to respond to Ebola. That error in interpretation ended up saving lives and saving Nigeria from Ebola in the first place. So as we are witnessing this launch, we need to realize that it's an additional element to this big puzzle of serving health sector challenges in Nigeria, which is, of course, very much welcome. Let me at this point congratulate the Honorable Minister of Health, Dr. Osage Heanire, on his leadership in bringing these initiatives to implementation status, and the entire Nemsas team for a diligent work done so far. As emergency medical services require a coordinated multisectorial approach, it's my wish that the signing of the MOU with relevant government and non-government institutions today will form a solid foundation for a functional emergency system for effective service delivery at the federal and the state level. Given the experience of COVID-19 response in recent times, I have no doubt that the Federal Ministry of Health, led by the Honorable Minister, will once again demonstrate the success of this intervention very soon, in collaboration with all key stakeholders, including the state, development partners, and the private sector. Honorable Minister, Excellencies, distinguished colleagues, ladies and gentlemen, WHO, with our mandate, will continue to provide our support to the government of Nigeria to achieve the health goal. We were part of the signing of the compact, which is an MOU, to help track our mutual responsibility. We will truly welcome the government inviting WHO and development partners to help track and monitor the effectiveness of this system and other systems that are already underway in the state. Finally, as the duty of achieving universal health coverage and health security in Nigeria is collective responsibility, I once again seize this opportunity to appreciate the support and collaboration of my colleagues and partners while soliciting for stronger collective support toward promoting health, keeping the world safe, and serving the most vulnerable in Nigeria. I thank you for your attention.
Thank you so much, WHO country rep. The next on our lineup, it's the goodwill message from the World Bank. And we have the World Bank represented here by Olumide Okunola. Please give him a round of applause.
Good afternoon, all protocols duly observed. On behalf of the Country Director, World Bank in Nigeria, Professor Shubham Chaudhary, it's a delight to be here, and congratulations to all stakeholders in the sector. Nigeria is committed to the aspirations of universal health coverage, and that commitment can be seen in the implementation of Basic Healthcare Provision Fund, where huge chunks of public financing is used to guarantee care, including emergency services for those who are poor and vulnerable. And I believe that even the government is doing a whole lot more. It is simply the right thing to do. The second thing to mention is that there are a few things in the design elements of the Nemsas program that we're launching today. First, it holds its counterparts accountable. The FRSC representative said, I hope Nemsas will pay in good time, which is really the basis of what we are doing today. So there will be signing with FRSC, NHIS, and other stakeholders. In other words, it's not just making available that quantum of public financing, but it is making that money available based on a defined contract. The second thing to look at here is that FRSC is not just being paid, FCT is just not being paid. You are being paid based on the quality and level of care you deliver. The third point to look at is that this contract will be with both public and private providers. If we look at these three design elements, even though it's happening in the microcosm of an EMS service, perhaps that should govern health system reforms writ large. Those three elements must be the priority of our health system reform efforts: strategic purchasing, attention to quality and accountability, and to purchase care from whoever is best able to deliver that care. On my last point, the country director has assured that we will support this program. We already have a large program called Impact, a $500 million program across about 14 states. A key part of a component of that program supports the implementation of this program in rural and underserved areas. So this launch today will help kickstart that little component of the Impact program. On that note, honorable ministers, congratulations.
It's time to invite the UNICEF country representative for Nigeria to come forward for the UNICEF goodwill message. Dr. Hawkins? Mr. Peter Hawkins.
Thank you. Honourable Minister of Health, Honourable Minister of the Federal Capital Territories, Honourable Minister of Humanitarian Affairs, Natural Disasters, Social Protection, Minister of State for Health, my brother and the person who taught me everything about health in Nigeria, the Senate Health Committee Chair, all protocols respected. This is truly a momentous day, I think, in terms of trying to help us reduce maternal and child mortality here in Nigeria. There are two components that are essential in doing that. First and foremost, a robust primary healthcare system strengthened to be able to look after the normal needs of all children and mothers expecting to have children. But there are times when a timely emergency service is required for the referral system from primary health to secondary hospital and secondary to tertiary hospital. If that timely emergency service is not available, then the child, in many cases the newborn child, or the mother, of which 200 die a day, of pregnant women in Nigeria, 200 die a day. If that service is not available, then there's very little alternative. So I want to congratulate the Honourable Minister and everybody here in putting this service up to complement the existing traditional community transport services, which are so crucial, and to help ensure that that timely emergency service is available to all wherever they may be. Congratulations and thank you very much.
Thank you so much. As we look forward to reversing the trend of Nigeria's high maternal and child mortality through this initiative. The last but not the least of the goodwill messages we have is coming from the Global Fund. And we have in our midst the portfolio manager for Nigeria, Jean Thomas Nombrosi. A round of applause for him, please.
Honorable Minister for Health, other honorable ministers, honorable dignitaries, all protocol observed. It's a real pleasure for me, coming from the Global Fund, to attend this launch of the National Emergency. Already 32 ambulances under the COVID response mechanism. And we've planned to provide another 72 ambulances under the current ongoing mechanism. They have been procured. So Today, I will ensure our executive director that, yes, not only this we are sure it will come, but there is already a good framework. And I was very pleased to hear that there is even a legal framework to support this. I was very pleased to hear all the involvement of the health commissioners, that's the multi-stakeholder involvement, and it's a real pleasure, Honorable Minister, to know that this is not only something belonging to health, but it's the entire country that is behind this initiative. So we really support this operationalization. And you know, Honorable Minister, that sustainability is back into our heart. So we hope that this will not only be fully implemented, that you will provide also some some ground for it to be sustainable and for it to be accountable for those who will be managing this, to really be accountable to the Nigeria people for these services. So thank you to all, and it's a big pleasure to be part of this launch. Thanks.
Thank you so much. Moving on now, we have on the program a panel conversation on the role of emergency medical services in Nigeria's universal health coverage. And the moderator for this, it's no other person than Dr. Lumide Okunola of the World Bank. We're going to allocate just 20 minutes for this panel conversation, and we're hoping that the panelists will stick to time. Thank you.
Thank you very much. We're going to have perhaps the shortest panel known to mankind. So may I just call on all panelists who are in the hall to please just make their way to the podium. Dr. Felix Ogedegbe, Chairman, NMHC, Professor Sidney, Dr. Pamela Ajayi, Dr. Jaf Momo, Dr. Salma Anas Ibrahim. Okay, good. If you actually give them a round of applause, they will move. Can I just check that Mickey Chopra is online? He's connected from Washington, D.C., and he's been awake for the past 4 or 5 hours. Thank you, Mickey, for bearing with us. Can we hear Mickey? Otherwise, we'll come back to Mickey as soon as we get a confirmation that he is connected.
I was mentioned the first delay, which is very important. It's all about decision making. Who decides whether the woman access quality antenatal care services? Who decides whether she's delivered by a skilled birth attendant and at what time? Because it's an emergency. I always say every pregnancy is an emergency. You don't know how it is going to turn out to be. The same thing applies also to the children. So this is the first step of the delay. And then the second delay, even after decisions are taken, who convey them to the nearest health facility where they can have access to quality healthcare services. And that is where the transportation comes in. And then the third delay, even at the point of the facility, there's another delay. Delay in accessing quality services, which could be due to several factors: availability, affordability, lack of human resources, so many things. So we can see this is a summary of the 3 delays. So at every point, I can see that Nemsas is not only going to address the second delay, it's also going to address the first delay, the decision making.
Thank you.
Because someone can hear that a woman is dying, and quickly he will call an ambulance. And at the point of pickup, services will be provided. If a woman is bleeding, you address the bleeding. If a child needs oxygen, you administer.
I like the way you have linked the first two delays, and that actually takes me to the third delay. So government has provided, we said, no, government needs to put money into healthcare. They have put it. Public financing to guarantee for the poor and vulnerable. All right? So we have an ambulance system in place. The decision has been made. This patient now gets to the hospital, and yet the facilities are found wanting. Dr. Jaff Momo, CMD National Hospital. There's a lot of complaints about facilities not delivering what they're meant to do. Now, even when we're building this system, how do we hold facilities accountable for care, even when the patient gets there in good time, like this will allow us to?
Thank you, Dr. Umide. I think it is imperative that facilities, healthcare providers,
Go on.
Okay.
Go on.
It is imperative that healthcare providers and facilities must make emergency care a priority, and this service must be available 24 hours. It is not something that can be shut down. Emergency care will not only include trauma, but medical emergencies, pediatric emergencies, obstetrics emergency, and even gynecological emergencies. And all these must be available with the right staffing, 24 hours. And I think what we should do to hold facilities accountable is to have measurable outcomes that you can use to measure how long did it take this facility to attend to these patients, and what was the outcome eventually. And of course, there must be a way to reimburse the facilities promptly so that they can continuously be held accountable. I want to reemphasize the need for emergency points in the hospital to be readily accessible to the patients, and as soon as they enter the hospital, they must know where is the emergency point. You will notice in the National Hospital that as soon as we enter the gate, the first signboard post that stares at you is emergency building. And so you know where you are going. You don't have to even ask any questions. And when you get there, there are there are staff on duty 24 hours of the day, and we can be held accountable because our system is now computerized. So when you come in, the time you are seen is automatically on the system and can be audited. So there must be measurable outcomes, and there must be the National Standards Committee, which is domiciled in the Ministry of Health, must measure and evaluate from time to time so that it will not be a matter of hearsay. Thank you.
Thank you very much, Dr. Momo. I take something away from your intervention. Accountability is a two-way street. First, all of those things that you have said must be in place within the facility, but when you also deliver the services, then you must also, the counterparty must be ready to reimburse in good time. Because I like to emphasize this design aspect. Here, it is not so much about buying ambulances, which we have done for 50 years. It is about putting an accountable system in place, and with all of the kind of key indicators you have mentioned. Are we able to get Mickey now? Mickey, can you say hello if you can hear us?
Hello.
Okay, we still can't hear Mickey, but not a problem. We'll move quickly to Dr. Pamela Ajayi, who flew in from Lagos for this event. She's the president of the Healthcare Federation of Nigeria. Like I've emphasized, a key design element of the Nemsas is the incorporation of the private sector into the delivery of this program. And that's a key difference between what we have done before. But beyond just the provision of assets, there are also other things and other ways that the private sector can help this program go to scale. Can you share some of this with us?
Thank you very much. All protocols observed. I must say that this is a very, very welcome program to us. We want to thank the Minister of Health for the inclusion of the private sector in this way. And I would go so far as to say we're moving from public-private partnerships to public-private integration, which is where we really need to be. The private sector would help to drive this initiative, and we're standing by to do this in a number of ways. From the beginning, which is the communication, we have health tech, very strong health technology platforms that can build platforms and develop the systems that are required for the communication. We are also standing by to provide transportation systems from the beginning to the end. What I mean is from fully fledged, highly sophisticated ambulance systems to innovative systems such as vehicles like boats, or as even previously mentioned, keke marwas, and other kinds of innovative systems because of the diverse nature of our country. Within the hospitals, we have a wide range of hospitals scattered throughout the country. And in fact, in Lagos State, in the meeting we had over the weekend, declared that there were over 4,000 in the state, thereby enabling such states to have easy access, quick access to hospitals who can provide the care. When we talk about pre-hospital care, I want to take a special moment to actually also commend the Honorable Minister for the passing of the provision of the Emergency Agency Bill. Because within that Emergency Agency Bill lies the First Responders Law. Now that First Responders Law is absolutely critical for the legal protection of people who go to assist others in others in need. And one of the things I think that we need to also consider is the provision of a desk within the operations of the police. Because the police are often called to these emergencies, they need to be trained as first responders so that they can also link up to our private sector and the public sector facilities, and also to prevent the harassment of people when they are doing their duties, in particular when they are trying to assist persons in need.
Thank you very much. You bring up some key elements but I guess this is just the first step in a long journey. I'm sure some of the key stakeholders are actually noting some of your recommendations. Do we have Mickey now? Mickey, can you say hello?
Good afternoon. Hello.
Good. Thank you. We're happy to have you here. So Mickey is the global lead for service delivery at the World Bank, and he's one of the people thinking through how can we improve service delivery for emergencies and service delivery more broadly. So essential emergency and critical care is a first-line, low-cost universal care that should be provided to all critically ill patients across health systems globally. How do we ensure that EECC is prioritized across health systems as a key UHC objective? The WHO rep said now, UHC, emergency, pandemic preparedness, these are all part of the UHC agenda. Mickey, over to you.
Thank you, and good afternoon, and all protocols observed. First of all, just to congratulate the Minister and the country for such a far-sighted and ahead of the curve, if you like, initiative and investment that you're making. One of the key lessons we've learned from COVID, indeed, was that we lost far more lives because of the lack of basic emergency care than we did because of the lack of ICU beds or ventilators. Basic care, stabilization, oxygen, these kinds of basic elements have been found wanting in many systems and cause excess mortality. We estimate about 1 million lives a year are lost because of this lack of transport, but also first-level care at the facility. So it's an overlooked element of universal health care, as you've mentioned. And so the work and the initiative that we are celebrating today is very, very welcome. I would just emphasize 3 elements which have been stated already, but I really wanted to bring them to the fore. That this, first of all, this is the beginning and not the end. So without dealing with the care that the patients receive when they get to the hospital or the facility will mean that the investment in ambulances will be for naught. So improving the quality of care at the first level receiving facility is just as important as making sure the ambulances work and get there. And that doesn't require the two elements that have been mentioned already, and I would like to emphasize them, which is related to governance and accountability as well as performance. So the first, indeed, is the metrics, is having a clear set of metrics which articulate and measure the availability of the basic elements required for essential care, critical care, whether it ranges from first aid through to trained personnel, through to oxygen at the facility. So having this clearly articulated and made visible, I think will be a next important step in this line. And related to that, of course, is accountability, that if these things are not available, who's held accountable, what are the incentives, both positive as well as supportive, for that. So the accountability framework must also be clear, and this is a really brilliant first step, and I really congratulate the Minister and the team and the country for one of the first large-scale initiatives we're seeing in the region focusing on this critical element, which has always been overlooked. Thank you.
Thank you very much, Mickey. We would examine the accountability question a lot more when we get to Dr. Ogedegbe. Professor Sidney, you're the country director of the United Nations Decade of Action on Road Safety and Injury Prevention, UNDASIP. UNDASIP will need to provide extensive collaboration of platforms for partnership for this EMS program to be viable and to achieve what it's set out to do. What are some of the key things that UNDASIP is bringing to the table?
Thank you, Moderator. The Honourable Ministers, distinguished members of this great occasion, I wish to congratulate the Honourable Minister of Health for this very important making event. And on the part of UN Decade of Action on Road Safety and Injury Prevention, as you all do know, is a multi-stakeholder forum involving the various aspects, both the government, the organized private sector, and civil society group. And we've been around for about 11th year, chaired by the Vice President. So it provides a very strong forum involving all the key stakeholders, which we hope to bring on board to ensure that these Nemsas coming on board today is something that will be sustainable. And having said that, we're looking beyond the health sector operators. You also have the non-health sector operators. You have the Nigerian public. They need to know. They need to know that this system exists, that there's a number that you can call when there's emergency, whether it's midnight, whether it's whatever time it is, that they call the 112 number and somebody will answer. So the Nigerian public need to know and buy into this system, because that's how it's going to work. If you do have a system that is functional, you might have all the capacity, but if the public do not buy into it, do not know that this system exists, of course it will still remain the same. Having said that, you also need to enlighten the public, the Nigerian public, on how to behave. An ambulance is carrying a sick person and running to a hospital. The road users need to know that they need to give way for the ambulance to access the facilities. Otherwise, it will still be something. And so there's a lot of work need to be done. And we have the Nigerian Orientation Agency as part of our stakeholder, so we'll reach out to them. Like I said, operating at the highest level of governance with the Vice President as the chair, who also chairs the National Economic Forum. So we also have the sub-national government at the state levels, the local government levels. Okay? So we hope that with the collaboration which we have established, and then we'll bring it on board with the Ministry of Health serving as the Secretariat again, with Nemsas fusing together, I think, of course, we should be able to deliver this quality service that we've all envisaged and talked about. And I think it's a very welcome development.
Thank you very much, Professor Sidney. Maybe it's useful to just very quickly look at the architecture of Nemsas. First, you have the Federal Road Safety, delivering service on federal roads, delivering service on federal roads in a particular state. You have Nemsas also contracting the state program, implementing emergency services statewide. Within that is the third element, which is the rural ambulance kind of model. And the Honorable Minister took us to Taraba, Ukari Taraba, where we saw this Kekemawa kind of model. So I believe that a lot of thinking has gone into the typology where you have these stakeholders, FRSC, the state actors, and then working with local government at the rural level. Dr. Ogedegbe, you're chairman of NMTC. In England and in other places, once you put a call through to an ambulance, that ambulance must get to you in 7 minutes. In Australia, it's 10 minutes, I think. So different climes have different indicators. What do you want our stakeholders to hold yourself and Dr. Seidu accountable for? So that we call you, we call an ambulance, it got to us after 1 hour. How do you want us to hold you accountable?
Yes, Dr. Thank you very much for that. Honorable Minister of Health, all protocols observed. I'm sure that's a question on everybody's lips. What do we expect after this? What do we expect from Nemsas? How do we hold the system accountable? And what's going to be different from what used to be in the past? I think we've got a model in the framework for the implementation that actually takes a lot of these questions, into consideration. And if you read the manual that's been launched today, we've laid a lot of credence on monitoring and evaluation. And there are simple things, there are low-hanging fruits, and there are those that are a bit more complex as we see them as they come along. The Honorable Minister for Humanitarian Affairs did mention that up to this point probably or in the past, people think the ambulance is for the dead body. So there has to be some paradigm shifts. We have to now understand that ambulances are made for living people in an attempt to make them continue to live and not die. So there are those two aspects of emergency medical service that easily come to mind, the pre-hospital side and the in-hospital side. And the in-hospital, of course, relies heavily on the primary, secondary, and tertiary services that are already existing. But the pre-hospital is probably the one that is very new and needs to be coordinated. And there are easy ways of knowing how you're doing. Olumide, you've mentioned one, for instance, the response time. First of all, now, people go to the hospitals anyway, but they're not taken by ambulances. They're taking the private cars. Sometimes people put somebody at the back to go to the hospital. We need to have a mechanism where we know how many people going forward are now delivered to emergency centers by ambulances, as against the past when very few people got to hospitals by ambulances. In terms of the framework we're going to be operating on, this is where we're actually lucky, unlike those who started emergency medical service many years ago when phones didn't work, you could not really have a software environment. We've got a software environment now, so it can't be timed. When did you call? What kind of response did you get? Everything is online and everything is actually recorded. And how much time did it take? I can assure you, Olumide, that we're not going to start by getting everybody to hospital in 7 minutes. But we should ensure that over time, the response times improve and that the delivery to hospital improves. The kind of care that you get in hospital improves. One of the things we're going to really measure, and this will be mentioned again by all the distinguished people that have spoken this evening, people get to hospital, do they get care? They don't get care because there's no money to put down. And that's one thing that the Honorable Minister of Health has put as a backbone of the Nemsas service. There is no payment at the point of care. I did hear somebody say it's a free service. It's not a free service. Absolutely not a free service. But there is no demand for payment at the point of care. The Nemsas program, backed by the NEMTC, thus give providers a guarantee of payment, such that the person who has been attended to where he's unable to pay, there's a basic healthcare provision fund and other funds that we're going to be expanding into that would give the providers the comfort that they should go ahead and treat and they'll get paid. So, thank you. So we do really expect that we'll be able to monitor how many patients go to hospital and how many patients were refused treatment on the basis of not being able to pay. One other thing, if I may just add that, it's very easy in this city, for instance, and thankfully we're starting with the FCT, that you go to hospital A, hospital says no bed. You go to B, no bed, C, no bed. Where with the coordinated system that we are talking about, the ambulance service does that calling for you. Already calls the hospital and they say there's no bed in National, but there's bed in Wuse, so that ambulance just gets rerouted to where there's bed, where there are beds available. So I think these are things that we can have a robust computerized framework to monitor, and everybody here will be able to say what has improved over time. Thank you very much.
Thank you very much. Thank you, Dr. Ogedegbe. Even though you did not exactly answer my question, but I'll let that ride. But you know, I think the Minister of FCT deserves a round of applause. So this partnership did not come for free. Nemsas insisted that it put certain things in place, which they did. So I'm saying this because Dr. Betta Edu, Chairman Commissioners Forum, Dr. Tomi Koka from Ogun State, Commissioner of Health Ogun State, so that we can also begin to engage our governors more, that this partnership is not really a free ride, but you also have to put in place making sure that your facilities are ready to receive those patients and you're also ready to deploy some assets. We got 5 minutes to go. Professor Sidney, in 1 minute, anything left unsaid that you would like to share very quickly?
Well, all I need to do is to tell the Nigerians that this is a system that has come to stay and a system that is available to them. And if we use what has been put in place and use it appropriately, a lot of lives will be saved and a lot of mothers will no longer die during childbirth and a lot of children who are ill will be saved.
In good time.
They are available for them and they should use it.
Thank you very much.
Thank you.
Dr. Salma, you need to put on your microphone. Yeah.
It is a laudable initiative that will bring a lot of positive impact in saving the lives of women, children, adolescents, and everybody in Nigeria. But we have to manage it very, very carefully because partnership is power, and we cannot leave any of the group behind. So I'm just thinking that we've not mentioned so much about community structures, because most of the victims, if you look at the space of the maternal and child health that die, they are not mostly people like I and you here. They are mostly people that do not have access, do not have information, and they are also battling with a lot of misinformation. So we have to carry along the community structures, the traditional leaders, the faith-based. If we don't manage it well, we are going to run the risk of stigmatization, just like we are still struggling with the COVID vaccine in Nigeria. Thank you, Honorable Minister.
Thank you very much, Dr. Salma. Dr. Pamela Ajayi.
Thank you very much. I must say, with this program, we're looking forward to the improvement of all our health indices here in Nigeria, the life expectancy, and the maternal infant mortality rates, and so on. But one area that I'd also like to mention is the issue of personnel. Right now, there must be a serious focus on the training and development of the personnel that are going to be used within the ambulances. I know there's a gap there, and I must tell you that in that area also, the private sector is willing to step up to the plate to provide those services. Thank you.
Point well made. Dr. Jaff Momo.
I will just start from where Dr. Ajayi has stopped, the issue of training of staff, personnel in the ambulance system. We are partnering with road safety on that at the National Hospital, on training first responders, and also the staff on ground must receive regular basic life support training. All emergency staff in various units must be trained regularly and retrained such that the response time and the ability to respond is also maintained. and providers must ensure that the competent staff are available in the emergency centers and units around the clock. Thank you.
Thank you very much. Do we have Miki Chopra available? Miki?
Yes, can you still hear me?
Yes, please go ahead, Miki. Last word.
No, just to say at the bank, we're very excited by this initiative and we're fully behind further work and support, and particularly around the issues that have been raised by the panelists around measurement, accountability, evaluation, and expansion. Thank you very much, and congratulations.
Thank you, Miki. And you can go back to sleep now. Dr. Ogedegbe.
It's just the beginning of my day. Thank you.
Right. Good.
Yes. So it does seem that as we continue to strive for universal health coverage, as we continue to put efforts into primary, secondary, and tertiary care, perhaps our rewards and outcomes have plateaued and have maintained very poor health indices because we've not put some effort into emergency medical service. It does seem to me that once we start to unlock this key area of emergency medical service, we are directly improving access to care, and we may then see that this stagnation in the changes in our health indices will begin to go up again. And I'm very, very hopeful that once we unlock this area, that we're going to be all better for it. Thank you.
So, ladies and gentlemen, the implementation of Nemsas is not awarding of contract to buy ambulances or to buy anything at all other than to buy services, especially for those who are most marginalized in the society. In fact, if this kind of reform can work at this level, where all the ministry is managing is just a set of contracts, contract with road safety, contract with NCC to manage a call center, contract with providers, contract with states, maybe this should be food for thought as we begin to look at health system strengthening reforms at a much larger scale. Ladies and gentlemen, a round of applause for my distinguished panelists. They've done a great job. Thank you very much. So, you guys are wanting to come together. Sorry, maybe you take a quick picture. Thank you. Thank you.
You did very well.
Oh, sorry, sir.
Another round of applause for the panelists, please. Quite insightful conversation there, I must say. We're right at the heart of the matter, the reason why we're all gathered here today. But before then, I would like to quickly recognize some dignitaries in our midst. We have 3 commissioners of health from 3 states. 2 are here in person, and 1 is represented. The Commissioner for Health of Ogun State, Dr. Tomi Koka, is here. A round of applause for him, please. We also have Dr. Banji Ajaka. He's the Commissioner for Health, Ondo State. The Commissioner for Health, Kaduna State, is here represented by Dr. Kamwe Habila. And from the UNFPA, we have Dr. Samson Ezikanyi. A round of applause, please. We have a representative of the Inspector General of Police in our midst. Can you please stand for recognition? No, okay. We also have with us here Zakaria Walker. Zakaria Walker is representing the Director General NEMA. Thank you so much. Moving on now to the reason we're all gathered here today. We're here for the signing of the Memorandum of Partnership for the operationalization of the National Emergency Medical Service and Ambulance System, Nemsas. To do that, I would like to invite the National Program Manager for Nemsas, who is going to coordinate the signing of the MOU. Dr. Said Dambulwa, as the National Program Manager, will coordinate the signing of the MOU. Dr. Said, please.
Thank you very much, Rabi, for the good job you have done so far. Now we are coming to the next activity of the programs, event of the programs for today. That is the signing of the Memorandum of Understanding. We are going to start with the FCT, and may I call the barrister from the FCT administration, Mrs. Pasanya, and Barrister Alladi to come forward, please. And meanwhile, we're going to have the Honourable Minister of Health and the Honourable Minister of FCTA seated by the side, while the barristers actually issue the MOUs for them to sign accordingly. And after that one, we call the next Federal Safety will come forward also with their own legal team and the legal team from the ministry and the Minister of Health and the Co-Marshal, who is ably represented by DCP, Deputy Co-Marshal, to sign the MOU for the road safety. Please, may I invite the barrister, please come forward, please. Barrister Alladi, please come forward, and Isa, please come and assist, please. Please be seated. May I invite the Honourable Minister of Health to come forward, please, and his colleague, Honourable Minister of FCT. Please, the folder of FCTA is there, please. Mrs. Fosanya, kindly take the folder of FCTA, please, and we have 3 copies of the MOU for signature, and all the copies will be signed accordingly by 2 ministers. Isa, when you please give, because of the photographers. The essence of this, the obligations of this MOU between FCT and the Federal Ministry of Health is we expect that the FCT shall set up FCT Nemsas, which is Program Implementation Unit. Implement the rollout of the EMS services in the FCT in accordance with the provisions in the Nemsas Implementation Manual, as it is going to be launched soon. Accredit EAAs and ETC service providers in the FCT in accordance with the implementation manual. Provide Nemsas, which are an updated list of EMS service providers accredited by the FCT on a monthly basis. Supervise and manage accredited service providers on behalf of Nemsas. Provide monetary evaluation of Nemsas program in the FCT and quality assurance. Manage the performance of the service in the FCT. So this is what we expect from the FCT administration as they are signing the document. Indeed, this is a history. We are very optimistic in the spirit of inclusiveness will change the narrative, the dismal indices of maternal mortality in Nigeria. It is important, and let's be on record, there is always a beginning. If there is no beginning of the beginning, beginning will never begin. And certainly we are not moving like a desert cloud without definite destination. Thank you, Honourable Ministers. Now, as I said earlier, this is the beginning of the beginning. Certainly the team from the FCT and the ministry, Nemsas, will start working. Thank you very much, Honourable Minister. Now may I actually ask the Honourable Minister to stay behind, Minister of Health, please, and call the Deputy Co-Marshal to sign on behalf of the Co-Marshal, Federal Road Safety, and the barrister from the Federal Ministry of Health also to be present, and the barrister from the Federal Road Safety Corps. So, this is the second session of the signature, signing of the memorandum of partnership to symbolize, it is aimed at symbolizing the partnership which is all-inclusive between the two organizations or agencies. The expectation, what we expect to come out from this signing of this MOU, what we expect to come out from the signing of this MOU, the responsibility of Federal Safety Corps, that Federal Safety Corps shall provide 5 ambulances for the pilot state to be stationed at designated points in order for Federal Safety to respond to emergency cases, rescue of victims of road traffic accident, crashes on all public roads, obstetric emergencies, pediatric emergencies, geriatric emergencies, surgical, as well as all other medical emergencies, as soon as you call 112. Federal Safety shall ensure all ambulances accredited to serve Nemsas shall be affiliated to 1 or 2 urgent care centers, to which patients will be taken unless otherwise instructed by dispatcher. Federal Safety, FRRC, ambulances participating in Nemsas shall carry the logo of Nemsas in addition to their logo along with a membership identification number. Federal Safety shall deploy its trained paramedics to the designated ambulances to respond to emergencies mentioned in clause 1A above. Federal Safety shall avail its toll-free number for use by victims of emergency cases. The toll-free number shall be integrated in the platform of the NCC. And the next sign-in, please, is the Guide of Medical Directors. Guide of Medical Directors, please may kindly come forward for the signature, please, the Honour Minister. Then after that one, Association of Private Medical Practitioners, please, you should get ready. Well, basically, as I said also earlier, that this is to symbolize a relationship because it's a public-private initiative, and this is a private kind of organization. It's a guild of medical directors. So we are going to be working with them. We are going to be working. Hello? The obligation of the Guild of Medical Directors is to identify and recommend their members participating in the program, ensure that their members comply with the terms of MOU, advise and ensure that compliance to a standard of mandatory continuing professional education, to ensure that members adhere to professional standard in their participation of the scheme, to be part of and representation in the accreditation and visitation for participating members of the association in the program, to apply appropriate sanctions to any of their members found wanting in professional capacity in participating in the program. It is history in the making. The next I'll be inviting is the president of the Association of Private Medical Practitioners of Nigeria. Please, the president of the Association of Private Medical Practitioners and the lawyer or anyone to witness on their behalf should get ready, please, for the signature. Thank you. Thank you very much. Now may I call the President of Private Medical Practitioners of Nigeria to sit with the Honourable Minister to sign the Memorandum of Partnership. You are welcome. And the last one is the signing of the Memorandum of Partnership by the National Health Insurance Scheme and the Nemsas of the Federal Ministry of Health. May I invite my professor and also a teacher to come forward to have a signature. This time around, the professor is going to sign with his own student for the Memorandum of Understanding and will allow the Honourable Minister of Health to go back to his seat. Well, the barrister from the National Health Insurance and barrister of the Federal Ministry of Health will be seated to sign the Memorandum of Understanding. Please, may I invite Rabi to come and continue? I will go downstairs to sign the MOU. Thank you.
Thank you so much. History is being made, and the dotted lines have been signed, committing stakeholders to ensuring efficient and effective, Nemsas, which we hope will translate to, changing the narrative of, on needless deaths from delays during emergency. Thank you so much. It's a moment we should be happy has taken place in the healthcare sector. And we'll look forward to the difference it seeks to make. Moving on. His first name. Before I introduce the next item on the agenda, I would like to quickly recognize the presence of the Health Secretary for the FCT, Dr. Kau. Please give him a round of applause. So without taking much of your time, as soon as the signing is over, we'll proceed to the next item here as we gradually wind down. Gradually winding down. Please put your hands together for them once more. So it's a done deal. The first step towards, oh, okay, sorry, we're not done. The National Health Insurance Scheme has a great role to play when it comes to the nation's efforts at the attainment of universal health coverage.
minister is going to say all, and you call the two guild. He's going to talk this and this.
NHIS and Guild of Guild of
Yes, these 2, 3. You call NHIS now to talk.
this one.
Yes.
Okay.
Okay, this one, just 1 minute.
Okay.
Ask him to talk.
Okay. The Executive Secretary NHIS is coming to the podium. Yes, to just give a remark, a 1-minute remark on what has just taken place. Professor Sambo, NHIS Executive Secretary.
The Honorable Minister of Health, Honorable Minister of State for Health, Honorable Minister of FCT, Distinguished Senator and Chairman, Senate Committee on Health, Minister of Humanitarian Affairs, ladies and gentlemen, good afternoon. Today we have witnessed the signing of Memorandum of Understanding between the stakeholders in the Nemsas program, which is a program that is designed to ensure easy access to emergency healthcare services to all Nigerians. A lot of discussions have gone into this laudable program, the initiative by the Honorable Minister of Health. And it has been ascertained that this program will be a turning point for all the emergency cases that we see, whether medical or surgical or obstetric emergency in Nigeria. And emergencies are the major causes of morbidity and mortality. In fact, yesterday I saw one fatal emergency that has taken place, is shown in the video, whereby many people in one bus caught with emergency and died instantaneously. I think with the implementation of this program, this kind of tragedy will be a thing of the past. To this end, we want to congratulate our Honorable Minister for this laudable initiative and the Honorable Minister of State. We all know the kind of effort that has gone into the implementation of this program. We also recognize the tremendous role that the Senate, under the chairmanship of distinguished Senator Olorebe, has done in ensuring that we have this very clearly defined basic health care provision fund. We also acknowledge the role of the Honorable Minister of FCT and other ministers that are here who have also supported this program, and the role that the Federal Road Safety Commission and other agencies will play in the exercise. And we hope that all the stakeholders will play the rule games according to the rule. And the role of the state government, especially under the leadership of the honorable commissioners, my sister, Dr. Beta Edu, to galvanize all the commissioners to give tremendous support to this exercise. And finally, to the developmental partners, especially the WHO and the World Bank, who have pledged tremendous, who have talked about the tremendous goodwill on this program and the readiness to support all that is going to come along with it. With this, I thank you very much for giving us opportunity to participate, and National Health Insurance will play its vital role in adhering to the memorandum that is signed today. Thank you, and God bless all of you.
Thank you. I would also like to invite Dr. Ike Odo. He is the President, Association of Nigerian Private Medical Practitioners, for 1 minute remark. Thank you.
Honorable Ministers of Health, Dr. Sergey Hinare, and all the ministers here present in the hall, our distinguished Senator, the Health Committee Chair, Senate Health Committee Chair, and our very dynamic Executive Secretary of the NHIS, who has pursued healthcare delivery as far as health insurance is concerned in the country with all the tenacity of purpose. I want to say on behalf of the Nigerian private doctors that after the Nigerian people, the healthcare providers of this country are the highest beneficiaries and the happiest today, that history is being made, that by the grace of God, moving forward, the average Nigerian man or woman or child out there who is ill and in their need can now access health care without recourse to whether he has money or not. We know that with all the support we are getting from every corner, especially from the Honorable Minister for Health and the Executive Secretary, universal health coverage will soon be a reality. And when that happens, that big umbrella we all look forward to cover every Nigerian will have been in place. And all this we are doing will be complementary and supplements to the mainstay of the program. I want to say thank you to the federal government, thank you to the Honorable Minister, and thank you to Nigerians. Today, as I stepped out of the airport, for example, as a private provider, I got a call. A patient, a young man that was brought in almost dead about 3 weeks ago, had been discharged. A balance of his bill of over 400,000 naira could not be paid. That man, I said, let him go. As a private provider, it means everything to us, and it discourages. But with what is happening today, sustainability is being guaranteed. Somebody told us here that 200 Nigerian women die every day. Another told us that 1 million out of every 7 million children die every year. Perhaps this is the more reason my association, the Association of Nigerian Private Medical Practitioners, has taken up a campaign, an advocacy for this country, our Save 1 Million Nigerian Mothers initiative, to summon up courage and stand for Nigerian women and children and bridge that gap and reduce the very high mortality rates of women and children in our country. As I speak, we have sent in a proposal to the NHIS, what we have called the Nigerian Pregnant Mothers Insurance Scheme, NPMIS. If this is supported, and I crave the indulgence of the Senate in the House and our Honorable Minister to support this great initiative, what we are proposing, let every Nigerian woman that is pregnant pay 10,000 naira. It will cover antenatal care, delivery, including cesarean section in hospitals. Because our research department has discovered that over 70% of Nigerian women who are pregnant do not go to hospitals. They go to maternities and TBAs, where care is very poor. And once there's an emergency, once there's a demand, most of them die. So let us save the Nigerian mother and child. Thank you, and God bless Nigeria.
Well, we all understand his passion for someone who sees those things happen from time to time. We are in an era of ICT, and of course we know that Nemsas is ICT driven. It is on that note that I would like to invite Mr. Ikechukwu Adende, who is representing the NCC at this event. Mr. Ikechukwu, please.
I would like to stand on the very well-established protocols and on behalf of the Executive Vice Chairman, CEO of the Nigerian Communications Commission, Professor Marugaraba Dambuta, who is unavoidably absent. I would like to congratulate the Federal Ministry of Health for this historic milestone event of the signing of the MOU for the implementation of this wonderful initiative, which we see health service delivery improved by leaps and bounds. the Nigerian Communications Commission, being the regulatory agency of the telecommunications sector, had way back over 2 decades ago recognized the importance of emergency communication and established the emergency communication centers across states of the country. By the last count in 2021, emergency communication centers have become operational in over 20 states, I think 25 states by December of last year. The emergency number 112 is the number that you dial to be able to reach the emergency centers across the country. And I think that the most enabling infrastructure for emergency services is communication. And today we see that what the Ministry of Health is doing cannot really happen without people having access to communication. In order to ensure that these communication services is available, what NCC has done is to ensure that 112 as an emergency number is available when you are both off network and on network. In other words, if you're in an area where there is no network service and you dial 112, you will be able to have access to the emergency centers. And that is a way of helping to deepen and ensure that people in areas where network coverage is not available can access telecommunication services in those times when there is emergency. So we'd like to congratulate the Federal Ministry of Health and assure that the NCC will continue to partner with you to advance the frontiers for improving this healthcare delivery system. Thank you very much, and God bless you.
Thank you, NCC. We're going to take the last remark in this category, and I'll be inviting Dr. Raymond Kuti. Dr. Raymond Kuti is the President, Guild of Medical Directors.
Good afternoon, honorable ministers. All protocols fully observed. And I want to thank everybody for the opportunity to be here today. We in the private sector, the medical doctors in the private sector, we see about 60 to 70% of patients in this country. We need the program that has just started today to help everybody to have access to good health. We usually say that qualitative good health is not cheap, but can be affordable. What do we mean by that? If we get the right things right, we are starting with a small one now, the ambulance services. If an average Nigerian can have access to cheap ambulance services for any medical services needed, we'll get to the root of most of the problems we have. And thank God FRCS is getting involved. I believe the police will also get involved, because the problem most private hospitals tend to have is with the law and the legal aspects of medical services. They bring a patient to you, accident victim, gunshot wounds, you treat, you may get in trouble as a private practitioner. But I believe with this we are having today, we'll start more of integration among both the public and the private, and which will help everybody. I want to thank everybody involved in this program, and I can assure you, like every other people have said in the private sector, we are very, very ready to get involved and to integrate into this system. Thank you very much.
I would like to crave your indulgence to take one last remark, because at the mention of road crashes, we know the integral role that the Federal Road Safety Corps plays when it comes to, tackling, carnage on our ways, so on our roads. So on that note, I would like to invite Ojeme Okaro. She is the Deputy Corps Marshal, Legal and Human Administration and Human Resource of the Federal Road Safety Corps.
The honorable ministers here present, ladies and gentlemen, on behalf of the FRSC, we are glad to be part of this. And like everybody has said, we hope that when we get to hospitals, so I'm glad that the Guild of Doctors and Directors are here, that when we take people to the hospitals, you will please accept them and you will please treat them. Thank you very much.
Very short and direct. Thank you. So, we're there now. I'm going to announce the next item, which is, incidentally, is the second important reason that we're gathered here today. Well, I'll first of all invite the Honorable Minister of Health, Dr. Osagie Ehanire, for his address, and of course, afterward, the official launch of Nemsas implementation manual. Honorable Minister of Health, sir.
The Honorable Minister of Federal Capital Territory, my landlord and brother and friend, the Honorable Minister of Humanitarian Affairs, Honorable Minister of State, Health, Chair of the Senate Committee on Health, and Permanent Secretaries here present, Corps Marshal as represented. I would like to ask your permit to rest on existing protocol so as to save time. It is my great pleasure and honor to witness and welcome participants and guests to today's signing ceremony of the National Emergency Medical Service and Ambulance System, Nemsas, multi-sectoral Memorandum of Understanding and launch of the implementation manual. Nemsas is the operational arm of the third disbursement gateway designated in the National Health Act, with a lot of foresight that was, with 5% of the basic healthcare provision fund for emergency medical treatment and meant to provide urgent health service to citizens at the moment and at the place of great health distress. To have the impact intended, a significant feature of Nemsas is that medical care is offered at no immediate out-of-pocket cost to the beneficiary at the point of care. If they had to pay for it at point of care, the purpose will be defeated. Emergency medical service is taken for granted in many countries. We know that there are, in the United States, it's 999, I think in UK it's 911, it's taken for granted. But such an intervention and the concept that we have adopted here, they are new, and they are novel in our health system, being the first of their kind at national scale, and because of the innovative features that we have adopted, which are designed to minimize the cost of operation and to increase the coverage by stretching the modest fund to pay for service rather than to embark on procurement and expend on maintenance of technical hardware, which will be unaffordable for a population and country the size of ours. The next feature of the program is that the Federal Ministry of Health invited the Association of Private Medical and Dental Practitioners, the Guild of Medical Directors, and many other stakeholders to form the Emergency Medical Treatment Committee, chaired by a private sector partner and approved by the National Council on Health at its 61st meeting in June 2018, and inaugurated in February 2019. Government hospitals alone and government ambulances will not be able to carry out this program in the entire country. So the private sector is also expected to bring in organizational acumen and a common understanding of program delivery, a common understanding of this program delivery as a public service initiative to be delivered at cost. The idea is to pool all existing material and human resource assets of both public and private providers to a combined platform using ambulances and hospitals, urgent care centers on a fee-for-service basis at the most cost-effective way to optimize the limited resources to operate the service at scale. And also the other assignment is to grow this 5% of basic healthcare provision fund by sourcing for additional income through donations and contributions, etc., to create a national fund as the service spreads around the country. The fee for service payment to service providers is by special agreement with a national health insurance scheme on their well-established electronic payment platform, a unique intersectoral collaboration that allows Nemsas to electronically reimburse accredited service providers who are registered with both NHIS and Nemsas for the service that they render, since NHIS already has a profile of most of these hospitals in Nigeria and is uploading ambulance service provider profiles also. There will be capacity to electronically locate, track, and verify ambulance movement with a software that is promised to us by a partner. Apart from engagement with the private medical sector, EMTC, emergency medical treatment, is built around collaboration with state ministries of health, relevant federal ministries, agencies, departments, civic society organizations, and even outside associations who all have a common interest or a common stake in providing medical help to persons whose lives are at risk, whether due to severe injury, due to sudden illness, or due to a health distress related to pregnancy or infection or an organ failure. In all these cases, medical help comes at the call of 112, a number provided and maintained by the Nigeria Communication Commission in 24 states. I'm told, I just heard him say 25 states. 24 states and counting. So 24 states will be eligible to join this program until all the others have the call facility. This call is free of charge as a public service for the sick or the injured, and it avoids delay in accessing treatment or transport. It is relayed to manned emergency operation center of every state and the FCT. So we are going to be using the EOC of every state and the FCT. Now, emergency medical service is delivered along 3 operational pathways. The coverage of highways and roads will mostly be in collaborative partnership with the Federal Road Safety Corps. And the coverage of emergencies within states and the FCT, working in collaboration with the private sector and also with respected authorities, which will be involving domestic, workplace, assault or sport injuries and incidents. And finally, the third phase, which is the Rural Ambulance Service, RAS. In collaboration with local government, RAS will attend to emergencies at ward and primary health care center to meet rural community emergency needs around access to maternal and child health, especially at odd hours of the day. We know that the problem of maternal mortality and child mortality is linked to inability to get to the facility. First, you must have the availability of the facility, which is why we are pushing for a primary health care system that is functional. And within the next few weeks, we are going to have a primary health care summit to have functional 24-hour active primary health care centers. Secondly, there must be the affordability, the ability to buy service, which is provided partially by the Basic Healthcare Provision Fund, and also will be greatly increased with the signing into law of the National Health Insurance Scheme Bill when it becomes an act that allows health insurance to become mandatory in the whole country and improve the fiscal space for health. The third problem is the problem of access. How do you get there at 1 o'clock in the night with an emergency? And this is where this particular program comes in, the emergency medical service and the ambulance system. This Nemsas program is the missing link that strengthens the national health system by filling the gap of poor physical and financial access to health care at time of dire need. We heard just now when it was said that a person might have an accident, be found unconscious, taken to hospital. He might be a billionaire, but at that moment he has no money in his pocket. And if you are insisting on money, well, there is a great risk to his survival. So it is to attend to the needs of persons who are in dire need and distress, and to coordinate referral services to move patients from one treatment level to another by ambulance in emergency situation. So that when you are told to go to someone who's not able to deliver, is told to go to a hospital, to a general hospital 50 miles away, and find their way, that is really cruel. And the emergency medical service comes in at that point. Now, the EMTC functions through a multi-sectoral stakeholder partnership to ensure service eventually becomes available to every Nigerian, regardless of where they live, and also regardless of any other factor, financial or economic. Ensuring access to timely emergency care is critical to meeting WHO's commitment in the 2019-2023 General Program of Work, which says it is to serve, in particular, the most disadvantaged, marginalized, hard-to-reach populations, including those affected by emergencies, and to ensure that no one is left behind. The program is part of the continuous effort of the Federal Ministry of Health and the federal government to respond to unmet needs in life-threatening medical situations, from injury and illness throughout the entire course. So regardless of your age group and regardless of circumstances, it's able to deliver prompt care on site and transport to accredited centers and enter the health system from there, all without meeting any financial conditions imposed on the patient. And all this will be at no cost within the first 48 hours. Service given this way removes barriers and saves lives in highly time-dependent emergency, and it's part of the basic minimum package of health care and emergency medical treatment that is promised in the National Health Act. The core of National Emergency Medical Treatment activity is to coordinate operations of Nemsas, including the approval of work and expenditure plan, and to relate with the accredited private and public health facilities and stakeholders, and to donors, especially for fundraising and management of funds, including oversight over service claims that are brought for payment. This project is no doubt ambitious, and it has been met in some places with skepticism by those who think it may not work because of its novelty and because it is perceived that we have no track record in running complex partnerships of this nature. And this very program depends seriously on partnership. But this program is also a very promising and much overdue initiative that could finally begin to address the high rate of maternal and under 5 and accident mortalities that we have in Nigeria, which have remained stagnant actually for a good number of years in the last few years, despite substantial government and partner investment to reduce them. The Nemsas program can solve issues of lives lost due to lack of first aid or first level treatment and due to lack of transport, either from home or from accident site to a treatment site, or also lives lost due to denial of treatment because of inability to pay. As the concept allows a dedication of most of the resources that is given to us, that's 5%, this concept allows us to dedicate most of these resources to actual purchase of service. We have best guarantee of value for money. Now, this ceremony we are here to sign today is not yet a program rollout. That program rollout in the FCT is coming in a matter of a few weeks. But we need this one to introduce partners, to introduce partnership, and to introduce the concept of emergency medical care. And we are going to be using lessons learned from the FCT delivery model, which we can join with the Honorable Minister of FCT to supervise and oversee, to do a rollout state by state with this functional one, for those states who have the functional 112 toll-free number, until all states in the country are integrated into a unit. Nigeria is striving, like other countries, to rebuild its economy in the wake of the COVID-19 pandemic and to construct new infrastructure to address existing gaps. The entire emergency medical system relies on a functional facility network of primary, secondary, and private health centers. The partnership with private health providers is indispensable in bridging what will be gaps in the infrastructure network of health facilities. Beyond supporting citizen health, this program will create jobs and also improve quality of life and stabilize our society. I wish at this point to recognize partners for their roles in getting Nemsas from zero to start and to the eventual rollout in the FCT. First, I must recognize the senators. I recognize Senator Lori Egbe, who, along with his colleagues, had it in mind that something must be put aside for emergency. Without that, we have nothing to start. That is seed money. It is seed money which we intend to start with. Next, I must also recognize Dr. Felix Ogedegbe of Cedar Crest Hospital, who is the chairman of the Emergency Medical Treatment Committee. He stands out here with his driving force, and without his zeal and involvement, we would not have been able to be here today. He even provided certain resources out of his pocket to fund certain aspects during this preparation, things which could not wait, he provided cash from his pocket. I look forward to the strong contribution of all our colleagues in the private sector and to the continued strong guidance from the chairman of the NEMTC until this program gets fully on its feet. Engaging the private sector potential, including their counsel, is key because the private sector owns over 60% of the ambulances in Nigeria and provide over 60% of care to Nigerian citizens. So this thing will not work without including their hospitals and their own assets. I also wish to commend and congratulate members of the NEMTC from both the private and public sector for guiding us to this first step. Because this concept is new, it has been difficult putting it together. We have no comparison from Europe, where the social structure is much more advanced than here. But as we all know, the journey of 1,000 miles begins with one step. And I recognize our partners, WHO, World Bank especially, they gave us a consultant. I recognize Federal Road Safety, and all others who have been with us and encouraging us here. I hope you all bring your wealth of experience to support this program as we begin to roll out the Nemsas Operation Relay. I recognize the work of the program manager, Dr. Seidu, who has dedicated himself to this program and deserves our full support. The program manual which we launched today is very detailed, but it is a work in progress. It is not perfect. It's a document ready to be improved upon and ready to be updated in the course of the real-life experience we shall make. Please feel free to make your contributions and make your suggestions. Finally, I must also here not forget to recognize His Excellency the President of the Republic for the inspiration he gives us and the free hand he gives us to shape things as we see fit for the country. I thank you all for your attention.
Put your hands together once more for the Honorable Minister of Health for that elaborate speech. We hope that it's going to be a win-win affair at the end of the day. We're not done. It is now time to take the remarks. They done the lunch?
Yes.
Huh? They done? Okay, Minister of State. Okay. The next item on the program is the Minister of State for Health's remarks. Dr. Olorunimbe Mamora is coming to give us his remarks before the vote of thanks. And of course, there will be a group photograph after the vote of thanks. So please, we urge the dignitaries to stay behind. Thank you. Honorable Minister of State for Health, Dr. Olorunimbe Mamora.
Wow, thank you very much. Let me align with the protocols already established. I don't want to stand on any protocol so that the protocol does not get into trouble. But then, not without recognizing our chief landlord here. That's the Minister of FCT. That's the chief landlord. Thank you very much. And dear sister, humanitarian minister, thank you very much. Well, the Honorable Minister of Health has put so much there, and of course, as colleagues, the first honors go to him. Thank you very much, Honorable Minister. Now, one of the things you start to think in your head when you are called upon to make remarks at this stage of a program, when virtually all the remarks have been exhausted. So you ask yourself, what is there to say again? The options are there. The first is to start repeating what others have said, and that will not be attractive. The second is to put more emphasis on some of the things that have been said. The third is to now think out of the box. That what is it that has not been said? One of the things that has not been said is that today is Valentine's Day. And you can see generous red all over the place, including my own tie. It's a shade of red. But talking seriously, Valentine is about love. And what this program is all about is giving love, not just to our community, to our nation, but to humanity. So it's a welcome program. And you recall that the representative of the Corps Marshal
She said, finally. That means this program has been long in coming. It has a prolonged gestational period, but it's born today, and born for good. She also said that she hopes that the parties concerned will pay what is due to them. That is very important, because a MOU has been signed. The beauty of this occasion does not lie in the elegance of what you have in that MOU, but the zeal with which what you have there is implemented. And somebody also said that it is not free. Yes, I've been to Freetown. Food is not free there. If anything is free, it's because some people are paying for it. And it's a complex and comprehensive program from the national to the state, the local government to the communities. So, which means we need a lot of collaboration, we need a lot of cooperation to make this program work. And somebody mentioned that the attitude, I think it's the chairman that mentioned that the attitude of our people. Anyone can be a victim of a situation that will require emergency attention. Therefore, motorists, road users, please, when you hear the ambulance siren, please just give way. That is what citizenship demands, no less. That is what it demands. Because anyone can be a victim of the situation requiring being carried to the hospital, or to convey to the hospital through ambulance. Please let us respect that as much as possible. And finally, as we greet ourselves in Lagos, I greet you, I rejoice with you, and I rejoice with myself. Thank you very much.
Thank you very much, Honourable Minister of State. May I humbly call the Honourable Ministers and the other dignitaries, please, to come forward for the launching of the implementation manual. Then thereafter, we come up for a group pictures with the implementation manual. Please, may I invite all to come forward? Yes, there. Yes. Then after the launch, please, you may come up. The ministers and the permanent secretary with development partners, please. Yes. Northern Governors Forum. And thereafter, you come up to the podium for a group picture, please. Thank you. All right. We can take.
So we have all the dignitaries joining the Minister of Health to launch the Nemsas implementation manual. Please raise the copies in your hands for the cameras, please. It's a historical moment. And just like the Minister of State for Health has said, when you remember 14th of February, Valentine's Day, you equally remember when history was made in the efforts to save lives in Nigeria. Okay. Oh, he's representing him? Okay. Okay. What is the vote of thanks? Okay. Can the dignitaries please, yes. Yeah. Vote of thanks is next on the lineup, and we invite Dr. Alex Oko for the vote of thanks for the day. Dr. Alex Oko, please. And as soon as she gives the vote of thanks, all the dignitaries will join the Minister of Health outside for a group photograph.
They should come nobody is listening to this vote of thanks again. The event is over. Minister is standing. He's going, sir. The Honorable Minister of Health.
Please, attention, please. The Permanent Secretary, Federal Minister of Health, is going to give a vote of thanks, ably represented by Dr. Alex Oko, the Director of Public Health. Thank you.
Even Minister is going. Ahmed.
Can you please sit back for the vote of thanks by the PAMSEC, Prime Minister of Health, ably represented by the Director of Public Health, Dr. Alex Oko. Thank you.
The Honorable Minister of Health, the Honorable Minister of State for Health, the Honorable Minister, Federal Capital Territory, the Chairman, Senate Committee on Health, permanent secretaries here present, please permit me to align with well-established protocols. My name is Dr. Alex Oko, and I have been directed to give the vote of thanks on behalf of the permanent secretary, who is unavoidably absent due to the exigencies of duty, and I will be reading his address. It is with great pleasure that I give the vote of thanks at this epoch-making event that demonstrates this administration's commitment to prioritizing the health of Nigerians through the implementation of the next-level healthcare agenda of Mr. President, anchored by the Honorable Ministers of Health. This further demonstrates the importance that Nigeria places on health development with a focus and determination to strengthen the appropriate pathways towards achieving universal health coverage and other health-related sustainable development goals where no one is left behind. The signing of the Memorandum of Understanding for operationalizing the National Emergency Medical Services and Ambulance System, Nemsas, and the launching of the Implementation Manual will facilitate the standardization of the response to medical emergencies in the country. The implementation of Nemsas will commence with the initial pilot rollout of the program in the FCT and then subsequent phased rollout in the 36 states of the Federation in an integrated and sustainable manner towards achieving national coverage at scale. The presence of different stakeholders here today gives overwhelming endorsement to the Nemsas program, which shows the readiness to work together to making this a success. The ministry would like to use this opportunity to appeal to the relevant stakeholders to adopt and comply with the strategies of the Nemsas manual to provide the implementation network for medical emergency response service delivery for the country. The time is right for the country to now have a befitting national medical emergency response program that is based on international standards but addresses our domestic requirements. As a ministry, we assure you of our commitment to a collaborative effort that will improve the medical emergency service and the entire healthcare delivery system for the country. I want to applaud such passion that has caused you all to gather here and to stay this long to launch the tools that will be used to address identified gaps and the missing links in the health sector in our quest to attain efficient, effective, and responsive medical emergency service delivery system that is affordable and accessible to all Nigerians. Let me expressly recognize and appreciate the efforts of the Honorable Minister of Health and Honorable Minister of State for Health for their leadership and providing the right direction in the health sector and making today a success and a reality. Their presence and active participation here at this public signing of the MOU and launching of the Nemsas implementation manual is a clear attestation of their dedication to this cause and the health sector in general. I would also like to thank all our partners, all stakeholders, media representatives from both the print and electronic media, volunteers, other participants, and indeed our invited guests and stakeholders for making this event a huge success. I wish everyone a safe return to their respective destinations. Thank you, and God bless the Federal Republic of Nigeria. God bless you all. Thank you.
Thank you for that vote of thanks. We are there, and the final item on the agenda is the group photograph outside. So can the dignitaries just please file out for the group photograph with the Honorable Minister of Health. Thank you. The group photographs, please. Thank you. Yes, sir. Wishing everyone here a safe return to your destination as we look forward to an efficient and effective Nemsas. Thank you, and God bless Nigeria.
Let me guide this one for you and give you